Morning, everyone. We'll just give people a couple more minutes and to join, and then we will get going. Right, we'll get started. There's a few more people due to come in, but I'm conscious of time and we've got a lot to get through today. So hello and welcome to the next seminar in or what is part of our Essex Health series. Really pleased to say we've got Emma from Pure Training and Development joining us today to take us through the cancer and exercise session. Just quickly, so you've got an idea of how we're going to run this morning's session. We are going to be recording this, so it will be available to download at some point after the session. Before I hand over to Emma, what we will do is Emma's going to run the session in two parts. So we will have a short break about halfway through just to allow you to grab another drink or stretch your legs. Please, as we go through the session, if you've got any questions that come up, please use the Q&A box to put those in. And my colleagues Kelly and Mel will be monitoring that. And at the end of Emma's presentation, we will then have a Q&A section where we'll try to answer as many of those questions as possible. Any questions that either we're unable to get to or we're not sure on, we will go away and try our best to find answers out. And then alongside the recorded webinar, we will publish the Q&A answers with that. So just before I hand over to Emma, Mel, can you pop up our first question, please? So hopefully on your screen now, you should see a poll come up. And we would like you to rate your knowledge of cancer and exercise, with 1 being no knowledge at all, 5 being very knowledgeable. And we'll just have a couple of minutes just to let the answers come in. So currently we've got 47% scoring a 2. So just give you another 30 seconds if you haven't had a chance to put that in. So that number 2 is up to 55%. Mel, if you're happy to publish the result for me on the screen, that would be great. Brilliant. So just using this to as a bit of a gauge really, and to help Emma have a bit of an understanding of what sort of knowledge we've got in the room. So we've got a high score, 53%, with 16 people voting a 2. So we're somewhere in the lower end of knowledge around cancer and exercise, Emma. So as I said, finally, I'll hand over to Emma. We've got a pretty packed session. As I say, please remember, any questions that come up, please put those into the Q&A box. Over to you, Emma. Thank you.
Thank you, Simon, and hello, everyone. I'm just going to quickly share my slides for you and we'll get started today. So welcome to our cancer and exercise workshop today, session today. Thank you for answering that question. So it just helps me tailor my information and how much time I spend on the sections. But as Simon said, we are going to break sort of just for 5 minutes in the middle. So the first section, we're going to look at what cancer is, cancer treatments, and get an understanding of this condition so that we can then look at the exercise and physical activity side afterwards. So really quickly, as an introduction to myself and a little bit of just a note here. So my name is Emma, as you know. I've got a background in exercise referral, and I am specialist in cancer and cardiac rehabilitation, and I've done that for around 10 years now. So it's really my passion to work with instructors like yourselves to make sure that we can increase our knowledge as much as possible so we can have a more inclusive environment, offer more to more people, and have really helpful and supportive conversations with them, which ultimately works towards long-term behavior change. And that's what we want. We don't want people just to start physical activity because maybe they're in pain, and once that pain goes, they stop. We really want to help educate them for the long term as to why they should remain active. So my note just to begin with this topic is cancer is obviously very complex, and there is further training that several people, particularly fitness professionals, can do. This is not going to give you a qualification to go and start working specifically with marketing yourself to this group. It does need extra time, and in a 1 hour and a bit session, we can't cover everything, but hopefully we'll give you a very good understanding of what's happening in the body and how we can help people, and possibly even where they can go for further support. So if this interests you, if this topic is you find it quite engaging, and maybe you do want to start specializing in this area, hopefully it fuels you to see what else is out there in terms of training to really help diversify your knowledge more. So within today's session, we're going to overview some of the common types of cancer, explore how they affect the body. And then once we've kind of been through that bit, we're then going to focus on the benefits of physical activity and exercise. We're going to highlight the key considerations that we need to take when working with this demographic. And throughout it, we're going to recognize and apply health and safety considerations for this group. So if you have any questions, like Simon said, please let me know and I'll answer them at the end. I'll do my best to answer them at the end. So we're going to get started with an introduction to cancer. I also appreciate that this topic, if I just say this now, can be very close to home and very personal for people. So if there's things that you aren't comfortable listening to or don't want to discuss, then maybe you just step away for those parts. All right, so cancer. It's caused by cells becoming abnormal. I think most of us know this, and there are a lot of different types of cancer, over 200 types. Now, of course, we're not going to be covering those today, but I want you to appreciate that cancer is actually a very unique thing for everyone. Everyone's going to have a different journey. There's going to be all these different types, all these different severities, and then how our bodies respond differently is going to influence how that person's cancer journey and survivorship occurs for them as well. In terms of just some statistics on this page and the next, 1 in 2 people will get cancer in their lifetime, which is not a nice statistic to have, but it's important to be aware of this because it means that nearly all of us will know somebody and likely train people that are either living with the disease or recovering from it. And for that reason, it's great that you're on the call today to have a little bit of a better understanding. So cancer develops in the form of tumours. So we have solid tumours, but we also get cancer that develops within the blood, and we'll highlight these two. We've got benign and malignant tumours too. So benign means not cancerous. You may have heard people that say, I've got a tumour, but it's benign. So that's not cancerous, not cancerous cells. Malignant tumours are cancerous cells. So these are just a couple of terms to be aware of, benign and malignant, when you're chatting to people. Now, I do just like to give you a perspective of the condition when we start. So just have a little look at the statistics here. We've got an estimated 3 million people living with cancer in the UK, and that's estimated to rise by 2030 to 4 million. So that's an awful lot of people. And as I just said before with the last statistic, that means that you're very likely to have a conversation, at very least, with someone living with the disease. 367,000 new cases occur in the UK every year, and that's around 1,000 cases every day. There's lots of stuff going on with the charities and different initiatives to try and encourage people to be active, lead healthy lifestyles, and of course raise money for these conditions, which is great. And hopefully today we can get a bit more familiar with some of those charities and resources too that can help further your knowledge and the information that you share with clients after this workshop today. Every 2 minutes, someone in the UK is diagnosed with cancer. 38% of cancer cases are preventable. So by having that little bit of extra knowledge, maybe we can help ourselves, our family members and other people to just make some small changes to our lifestyle that can potentially help. And the peak rate of cancer cases are in 85 to 89 years of age. So it's quite an older bracket for peak rate, but of course it happens to all ages. So let me just try and explain to you the pathophysiology of cancer. And it is hugely complex, and I'm certainly not going to go into the deep physiology of it. But what we do want to understand is the following. Our cells, our tissue cells, healthy cells, all the time divide and one dies. So we multiply and die. That's what happens all the time for every tissue in the body. That's what keeps it healthy. And we want this to happen. But when cancer cells occur, they multiply and one doesn't die. So that means that cells multiply over time, sometimes very quickly, sometimes much slower. Without them dying, it means they start to proliferate, which means they increase in size and eventually will cause a tumor to develop. They'll stack up on top of each other in the area that they've originated from and cause what we would generally say is a firm tumor. So the cell's nucleus is responsible for this process, and deep within our cells, we've got our DNA, and our DNA can mutate through different reasons, and this mutation causes the development of a cancer cell originally. And when cancer cells then one develops, it will then multiply with that same faulty DNA gene. So now we have two, and one of them's not dying, and then that one is going to multiply and not die, and it continues like that. So the process that tends to happen is we have this proliferation of cancer cells, so cells rapidly multiplying in a particular area. Now, the further they get away from their original destination, the further they are away from a blood supply, like a blood network. And so technically, they could die or stay the same. So at this point, when cells multiply and they don't have their own blood network, the cancer is considered a little bit more stable. It will stay in that area and hopefully, if caught early enough, be treated in that same area. However, cancer cells are nasty and they are clever, and they send out signals to encourage the nearby blood networks to sprout new roots and encourage a blood network to develop around these cancer cells. So we get a new fresh supply of oxygenated blood that continues to feed and fuel these cancer cells, allowing them to continue to multiply over time, making the size of the tumor increase, but also causing the likelihood of a metastasis to occur. So metastasis means that the cancer cells can now enter the bloodstream and find a new route, travel through the system, and potentially end up set in a second site. So we call that secondary cancer diagnosis. So that's when we start to see more complex cases, because the cancer cells have started to travel around the body. And of course, our blood network and our vascular network is very extensive, so it can go anywhere. And wherever it decides to then head to, it will bind to and then continue to multiply, not die, and cause maybe secondary tumors. The same process happens within the blood, but without the formation of a hard tumor, we get cancer developing within the bloodstream itself. So we see, in summary, healthy cells, they multiply and they die. Cancer cells multiply and don't die, which causes what we call proliferation. Then as the cells increase in number and size and they get further away from their starting location, they need a new development of oxygen supply. So they encourage blood vessels to go there. And as soon as they do, they can thrive and they'll stay there and they'll increase and keep going in size, but they also can potentially break away from their original destination and travel to other parts of the body. So we obviously want to do what we can to try and prevent this happening in the first place, but also help support people that are living with this condition to control as much as they have control of it, to control it. Now, healthy diets, healthy lifestyle habits like exercise, eating well, controlling stress levels, they can all help potentially prevent this process occurring. And later we'll touch upon whether exercise can actually prevent cancer in the first place. But whilst there's things that we can definitely do to steer off the likelihood of developing cancer, a lot of cancer cases are due to genetic and other uncontrollable factors, like environmental factors that maybe we can't control in its development. So it's such a high statistic. It doesn't mean that we can all just suddenly go, oh, let's just start changing everything we do and we won't get cancer. Unfortunately, there's a lot that's predisposed in our DNA. And but what we can do is try and reduce the likelihood of that cancer cell coming to life and starting to multiply by leading a really healthy, active lifestyle, because we're actually leading a lifestyle that's not carcinogenic. Whenever we eat really bad foods or we are inactive for long periods of time, it's quite carcinogenic, and carcinogens start to eat away at our healthy cells, allowing for the development of cancer cells to do their thing, as I just explained. So I just want to touch upon different groups of cancers. And again, I don't want to go into it in loads of detail. It's outside of the scope of this training, but hopefully at this point you understand like how the cancer is, what's happening at a cellular level. But where it happens and how we get these different types of cancers depends on where those cancer cells originally originate from. So we've got carcinomas. You may have heard of this term because this is the most prevalent type of cancer group, with about 85% of people having a carcinoma. So that's where the cancer cell starts on sort of a lining of the lung or bowel, stomach, or skin, for example. Whereas sarcomas start within our connective and supportive tissues. So you'll find the cancer cells around bone, fat, muscles, tendons, and cartilage. That's a lot less prevalent. So that's, I think, around 1% of cancers are sarcomas, as opposed to about 85% for carcinomas. Then you've got melanomas, which are cancers that make the cancers of the cells that cause your skin to have the color that it does. But brain, again, quite a small percentage. Brain and spinal cord cancers, so tumors that are developing in the skull around the brain and in the spinal column in our central nervous system. And then we've got what we've grouped together here are sort of our blood cancers. So we've got lymphomas, which are cancers of the lymphatic system. So you can call it a lymphatic cancer, but as it interlinks with blood-related cancers, it's sort of put in that bracket. So we've got here cancers that affect your lymphocytes, and your lymphocytes are part of your lymphatic system that take any kind of foreign object, bacteria, or in this case, cancer cells, and it destroys them and removes them from the body. And when we experience lymphomas, lymphatic cancers, it's because that role is not working. So it basically affects your immune system's function, deteriorates your immune system, and as such, allows for the cancer to continue doing its thing and causing havoc in the body. Leukemia is cancer of our white blood cells that are created within our bone marrow. And what happens generally in leukemia is that the white blood cells that are created from bone marrow are created in excess, but with a mutation, that means that they actually can't fight infection. So we get a lot more white blood cells, but white blood cells that can't function effectively and don't therefore support the immune system and protect the body from any bacteria, viruses, or otherwise. And then myelomas are within the plasma cells, and your plasma cells create antibodies, which again fight infection. So it's all related to try and keeping your immune system boosted. And again, if we've got cancer affecting the role of plasma and the development of antibodies, then again, we can't protect the body as effectively as we'd want to. So they're grouped together there as blood cancers. Now, of course, we could talk a lot more about sort of these, but ultimately what I want the message to come across at this point is that when someone says that they have cancer and it's of a certain area, hopefully you can now almost visualize that the development of those cancer cells dividing and multiplying is happening at this intended origin. And so we generally get like primary cancer diagnosis, and that's the original site. But then someone might say to you, or they might declare on a health form or something, that they've had a secondary diagnosis of cancer in X position of the body, and that's because those cancer cells have developed that network of blood vessels so they can receive oxygenated blood and they can travel, and maybe they've traveled to a different part of the body and then continue to proliferate there. Okay, I hope that makes sense so far. So here we can see what is the most recent data that we have at the moment for the most common types of cancer. And if you look there at the top 4, we've got breast cancer, prostate, lung, and bowel. And they make up for over half of the cases, new cases in the UK. So for men, it's prostate, lung, and bowel that are the most prevalent. And for women, it's breast, lung, and bowel. And because of this prevalence, it also means that the research in the field looking at, particularly for our case, exercise and physical activity and the prevention and the management of it, is focused a lot on these top 4 here. But that doesn't obviously mean that exercise isn't going to have an effect on the others. It's just this is the primary focus given the number of new cases. But as you work down that list there, you might have heard of people, you might know of people that have these other types of cancers that are slightly less prevalent, but still of course around, still important for us to know a little bit about and be aware of. Now, what I really want this workshop to be about is you understanding a bit about cancer, but mostly understanding how people are treated, because it's the treatment of cancer that tends to have the most significant impact on the body, which would then have the most significant impact on their physical activity and their health and lifestyle choices. So that was a whistle-stop tour of what's actually happening in the development of cancer, and I hope that that made sense to you. But if you need me to describe that anymore, let me know in the Q&A or chat section, and I'll do that again at the end. So this look at some of the common treatments, and I'm just going to focus on these 3 today: chemotherapy, radiotherapy, and surgery. For most, you're going to hear someone that's had at least one of these treatments, and sometimes it's going to be maybe a combination of them. So what we're going to do is we're going to look at what they're intended to do, and then we're going to look at what the person will be living with as a result of having these treatments. So let's start with chemotherapy. Chemotherapy is a very commonly used form of treatment, and it aims to stop the cancer development or slow down its progression over time. Now, it might be used as the only form of treatment for some people. They might be able to get all the cancer cells through rounds of chemotherapy. For others, it might be used in combination with something. So I'll touch on surgery in just a moment. But in some cases, chemotherapy is used ahead of surgery to try and shrink down the size of, say, a tumor. And in other cases, it will be a case of someone has some surgery and then they'll have rounds of chemotherapy afterwards to make sure that they got all of those cancer cells and removed them, killed them all, so that the risk of it reoccurring and developing is significantly lower. So whilst it can be used in isolation, it's often used within a different form of drug treatment plan. So it's going to treat the person at that time and hopefully prevent its return. Chemotherapy can be delivered in a variety of different ways. There's different types of drugs, different strengths, and then different administered ways. So it can go intravenously, it can go through a central line in the chest, it can be in tablet form or capsule form. And that's why I said at the start, this is a really complex field. There's so many different options for treatment, so many different ways that cancer can affect the body, that what we really need to take away as our main message is that it's going to be very individualized and tailored to the client. Whatever we do, whether we're sport, physio, exercise instructor, our methods need to be very much learning about that person and therefore tailoring it, which we'll come onto again a little bit later. Now, chemotherapy is generally given over a period of time, normally around 3 to 6 months of chemotherapy, and it's done in cycles. And again, these cycles can vary depending on the strength of the drug, the type of the drug, dependent on the type of cancer that they have. And it might be that someone has around 1 to 4 weeks of chemotherapy delivered. They'll have breaks within that time period, and then they'll have multiple cycles. So it might be that, for example, they have a 4-week treatment plan where they have treatment on a few days in a week, so maybe 3 days in a week, then they'll have a couple of days rest, 2 or 3 days rest, then they'll go through that cycle for the 4 weeks, and then they'll have a break after that, and then they'll re-go through that full cycle again, maybe 3, 4, 5, 6 times. It's very different per person, but just know that it's not a case of, normally it's not a case of just one round of chemotherapy and they're done. And the reason for that is not all cancer cells are active at any one time. So cancer cells that are multiplying are the ones that treatment can actually kill. But if the cancer cells are around, but they're not active, then the treatment doesn't actually kill them. And so that's why, like a second cycle, by the time a second cycle comes around, those dormant cancer cells might then be active and proliferating. So separating and dividing, and therefore that round of treatment is going to kill them. And over a period of time, it very much hopes to kill them all and therefore prevent its return. So my computer's gone to sleep. Hello, sorry, hang on. Are you all still with me, or have I frozen?
Yeah, I can still hear you, Emma.
You can still hear me, but I've frozen.
Maybe try to unshare and then share it.
I have, yeah, but I haven't got an active. Oh, technology. I haven't got an active keypad. Oh dear, hang on, give me a second. Let's work out what's going on here. Can you stop my share for those of you that are?
Yeah, let me
Right, if you just bear with us, we'll just try to reconnect Emma in, and hopefully we can pick up where we left off. So bear with us just for a minute or so, hopefully. Right, I've just heard from Emma, and as we were approaching the midpoint, just whilst we try to get Emma joined back in, if we want to take a 5-minute break, what we'll do is we'll put the break in now. So if you want to take a comfort break for the next 5 minutes, if you can try to be back for 10:05, and then we'll crack on and go through to the end from there. See you in 5.
Hi, Emma. You all right?
Hello, I'm so sorry.
Oh, don't worry. Don't panic. These things happen.
I just had a feeling that was going to happen, didn't I?
Don't worry.
I've only had this happen last year and now today because I talked about it.
You're back. Don't panic.
So we're doing break then.
We are, yeah. Put the break in now.
So I think someone tried to initiate on the screen. Was there any questions coming through?
Yeah, there's a question actually that's come in. It says, what are the deciding factors that dictate what type of cancer treatments are appropriate for an individual?
Yeah, I think that's one for a medical professional, but I can give an idea of that.
Okay.
This
goes on to ask, is it the case that certain types of cancer treatments respond better to certain types of cancer?
Yeah, that's pretty much it. Yeah, that is.
Yeah. Or is it down to a person's individual biochemistry, i.e. case-by-case basis?
Yeah, that's right. Yeah, I'll try and do a best to answer that one. Just need to check that I can screen share. I don't know if I can do that from this because I'm in a. It says oh. So is everyone else not? Can I try and share my screen now?
Yeah, you should be able to share, Emma, I reckon.
Okay. So are we live to everybody?
Yes.
Shall I crack on or answer the questions?
So we've just got until 5 past, so just another minute of the break.
Okay.
I think, Emma, as well, if I'll just make a note of the questions and then we'll do them at the end, if that's all right with you.
Yeah, I think so. That makes sense because I'm going to cover some of those questions in a bit anyway.
Okay.
Hopefully everyone can see my screen okay this time.
Yeah, you're all good.
Right, Emma, it's 5 past. If you want to carry on again, hopefully everybody is back.
Okay, hello again. Sorry about that. Technology let me down today, and I do apologize to interrupt that. I think we were talking about chemotherapy and the different cycles that people might have. And so just to reflect back on that, we said that people might have a number of weeks of treatment, and then those weeks will be repeated in cycles to get all of those cancer cells when they are active. So now let's talk about radiotherapy. And radiotherapy has very similar side effects as we're going to go on to, and of course, similar goals in that it's trying to kill the cancer cells and slow down their growth. So it's all about trying to, where possible, remove it entirely, but certainly slow down any progression. And that's why it might be used in combination with other treatments to really eradicate all of those cancer cells. Now, there's a couple of different ways that radiotherapy is provided. There's external, which I think you'll find is more common, which is where people will lie down. You've probably seen images of it. Use high energy rays to kill those cancer cells. And they are trying to target the particular area of the body. So let's say it's digestive related cancer, then radiotherapy will be targeted very specifically at that area of the body. There's also internal uses of radiotherapy, which is where they put radioactive materials inside the body closest to the tumor that has formed. And the benefit of doing both of these, I suppose, compared to chemotherapy, is that it could be a little bit more site specific, a little bit more targeted at that area. Because the problem with any cancer, any kind of cancer treatment, is that whilst it is killing those cancer cells, it's often killing healthy cells too. And the killing of the healthy cells is often a lot of the side effects that we actually see that people report, and it's because of those healthy cells being destroyed. Now with radiotherapy, because it can be more site specific, yes, there's still going to be healthy cells around that site that are affected, but it can be a lot more specific. So we've got internal and external uses of radiotherapy, and it's provided again in a similar way over a period of time, but not necessarily in full cycles like with chemotherapy. And it all depends on the severity of the cancer, the speed at which it's developing, the stage at which the treatment is being received, and so on. And then you've got surgery, which of course is a little bit more common sense, I suppose. It's aimed to remove that tumour in the one area. So for some individuals, the whole tumour can be removed through surgery alone, which is great, and then possibly in some cases be topped up with chemotherapy or radiotherapy to make sure all of those cancer cells have been removed. Other times, it might be that surgery is needed to decrease the size of a tumour, either before other treatment happens or because the tumour itself is causing side effects and pains. So this can happen with both benign and malignant tumours. Surgery is used because if a tumour is pressing against a nerve or even say a blood vessel, then the side effects and the implications it's going to have for that person are maybe greater than the cancer directly itself. So it might be that all of the tumour is removed or part of the tumour is removed through surgery, and then those other therapies that we just talked about can be used alongside of it to make it a lot more effective. So one of the questions that came in that Kelly just told me about was what determines what type of treatment people have. And, there is no one answer like, oh, you've got this type of cancer, so you'll have this type of treatment. There's lots of variables in there. As I said, the stage at which the person's cancer has been caught, the area that it's in terms of whether it's going to cause, are the side effects from a certain type of treatment going to be more impactful on that person's quality of life than no treatment or than a different type of treatment. Also things like age, elderly people aren't going to be put through the same types of cancer treatments as someone much younger. So there isn't a one size fits all. There is quite a lot of research that's being done on what's the best type of treatment, what's the best type of drug within a treatment, such as within the chemotherapy. And that kind of dictates it, but it's all very much done on a case-by-case basis. Yes, there are, of course, going to be certain types that are going to be used for certain types of cancers, but the length, the cycle, the type of drug, etc., they're all dependent on the situation and the person. So it's a really good question, and I hope I've answered it in part. And I think you probably already knew that as an answer, but it's one for sort of a medical professional for the most part. So just to yourself, if you just think about, can you list a side effect? I'm not going to hold on for this too long, but if you were thinking about someone that you know that's maybe been through chemotherapy, radiotherapy, or surgery, just have a think to yourself, do you know one adaptation that you might make as a result of what they might be experiencing, one consideration, or just have just a moment and just think, what generally do people report if they're going through any form of treatment that would possibly impact my session? So just give you a few seconds there. So I'm going to run through some of them, but it's important to know this is not an exhaustive list, okay? So we've got fatigue. Fatigue is the biggest one. It's going to affect all three of those conditions, all three of those treatment pathways and every condition. Now, I'd like to remind you that fatigue isn't just, I haven't had enough sleep and I need to go to bed a bit earlier and then I'll feel better the next day. Fatigue is very life impacting, and there's different levels of fatigue to the point that people can't or won't want to get out of bed because movement, daily activity of just getting themselves dressed is too much. Whereas others will go about daily life, maybe still go to work, for example, but really do struggle with fatigue in the evening. And this here is the thing that we need to focus on in terms of adapting our sessions around. When you have chemotherapy, it weakens your immune system and it changes things related to your blood count. So it changes the ratio of your white blood cells, your hemoglobin, and your platelets. And so what this means is that people might become a little bit more sensitive to bumps and grazes. Say, for example, if they accidentally knock themselves on a piece of fitness equipment or with a ball or a piece of equipment used in a sport, for example, they might bruise a bit quicker. They might also struggle with this fatigue due to the fact that hemoglobin, which carries your oxygen, is affected. So we've got changes in blood count that can be causing fatigue, along with the direct impact of the treatment causing fatigue. And the white blood cell counts means that people's immune systems generally are weakened through all of these types of treatments. And as a result, we need to think about cleanliness of equipment, venues, and trying to make sure that where possible, we minimize the risk of infection. We have weight gain. Weight gain causes people to really feel worse about themselves in general, especially since this weight gain isn't largely attributed just to inactivity or poor eating. The treatment itself causes changes within the metabolism, which cause weight gain. So if you've got someone that's going through this life-impacting condition, treatment is causing lots of side effects, and they're putting on weight, it's very clear to see that a lot of people's mental well-being is going to be affected as a result of all of these changes. So what I like to highlight here is reminding people that there's only so much they can do at this time, but know that they will have more control over this later down the line. So really trying to help them stay positive and optimistic about the things that are within their control whilst they're going through this treatment. Some individuals will have digestive issues, particularly if they're receiving chemotherapy through the vein, because it obviously is going through the full system, and then they might feel very nauseous, they might vomit, they might have diarrhea. And again, we can adapt exercise around this quite easily, but it's being mindful of it. So not only, of course, having the facilities to make sure that they feel comfortable, but talking to the client ahead of every session and making sure that they know that you are aware that they might not be feeling great. Some weeks might be worse than others, depending on what part of their treatment plan they are at. And so if they've had a very horrible time of feeling very unwell digestively, then it might be that the session needs to be reduced right down in intensity, and they focus on stretching and relaxation and mobility work as opposed to a structured session that day, because it's always going to be better to do something than nothing. So we've got peripheral neuropathy, and peripheral neuropathy means damage to the nerves in our extremities. So generally that is our fingertips and our feet. So within people that experience peripheral neuropathy, sort of things like holding a key and turning it in a lock, holding a pen, for example, they can be quite tricky for the hands. And then if it's in the feet, balance generally is the thing to be aware of. People's walking gait is likely to change. They sort of maybe appear like they're walking on stones without their shoes on. It's a bit uncomfortable, and we need to be aware of this in an exercise environment for balance too. We've got sleep disturbances. Often sleep is impacted through treatment, and sleep disturbances affect metabolism, can affect weight gain, and of course affects fatigue levels. So this can be a real problem. Mental health conditions, as I said, this is a life-impacting condition. People are going to be affected in terms of depression and anxiety, and where possible, we want to do what we can to support their well-being throughout. And individuals that are being treated with chemotherapy through a central line may have a line in their chest. And so it comes out, it's generally very stable and connected to the body so that they can move about and get themselves dressed without any problems. But you do want to be mindful in an exercise environment that you aren't going to use any equipment or do any movements that might be uncomfortable or not recommended for anyone with a central line fitted. So that won't be everybody, but if you've got a client that declares that, then be mindful of it. With radiotherapy, again, we have weakness, tiredness, and again, it's not a case they just need to sleep. They all need to have things adapted around them, and what types of activities and movements are better for them, so that they can do more frequently, rather than really overdoing it and then not wanting to return again, or it needing to be a long period of time before they can. Sore skin happens with radiotherapy, particularly the external radiotherapy. So the skin might be sore, it might be discolored, it might be flaky. And as a result, we want people to be aware of maybe what clothing they wear in an exercise environment, so that there's no skin rubbing through repetitive movements. And also with both of these treatments, really, swimming is generally not recommended, due to the lower immune system that the individuals have and the risk of infection, particularly if you've got open skin. Radiotherapy can cause stiff, tight muscles with reduced range of movement. So doing daily things like washing your hair and leaning down to put your shoes on and just moving about can feel quite uncomfortable. And if that's uncomfortable, people want to do it less. So it can be easier to become inactive. And it can impact your mental well-being. So exercise, we'll talk about in a second, is obviously going to be great at trying to control that and improve people's abilities in daily life. Depending on the area of radiotherapy, but as we said, it's very site specific. People might get specific symptoms and things that they have to live with. But for those being treated by radiotherapy for digestive and bladder related cancers, you're then going to get subsequent problems such as incontinence and what we said before with vomiting and diarrhea as a potential effect that they're living with. And then we've got lymphedema. So lymphedema is swelling in the lymph node area. I'm sure that probably most of you have heard of that. Most commonly related to people that have had breast cancer, living with breast cancer, and they'll get lymphedema under the arm, which restricts range of movement, and therefore you would adapt exercise for it. What's important to note here is that exercise does not cause greater levels of swelling and cause greater lymphedema to occur. So that's important because people might think that by increasing blood flow, you might be increasing the amount of lymph to travel to a particular area and accumulate. But actually exercise is going to be beneficial for that. But what we need to be mindful of is people's reduced range of movement or discomfort in certain areas of their body. It might be that they have lymphedema of the leg or the upper body. Getting to know that what they feel they can and cannot do in daily life is important so that we can tailor what it is that we do with these individuals, keep them safe, keep them comfortable and enjoying the session. And then, of course, for surgery, mostly common sense, we're going to have pain following surgery. But what's important to note is that pain has different levels and different lengths of time. So just screening the client to determine how it's impacting them, but also making sure that the pain that they're experiencing is expected pain as opposed to pain associated to infection or a new development of pain. And should anyone say that they have the latter, then that's when we want to encourage them to maybe check back in with their cancer support person to make sure that they have that reassessed. We said about fatigue affects all of the conditions, and we therefore are going to adapt the length of our sessions, the intensity to how that person's feeling on that given day. Bruising and numbness and swelling are all very natural things that happen as a result of surgery. And of course, they should ease as the recovery period goes on. But asking about any bruising or numbness that you can't see as a fitness professional is important so that you don't necessarily perform a certain range of movements that would be uncomfortable or maybe exacerbate the length of bruising. And we said about how people should just be careful in an environment so they don't knock themselves. As the platelets are working hard enough at this point, we want to make sure that the body recovers as fully as possible. Swelling is natural. It's what we want to happen, but ongoing swelling, ongoing inflammation is detrimental to people's health. So if you felt that someone's swelling should have maybe eased by now and it hasn't, or it's causing more problems for that individual, encouraging them to again go back to the person that has been looking after them is important, because you don't want to be doing anything to exacerbate any problems. And exercise can encourage swelling, general swelling, not lymphedema, if it's not a natural process. And then we've got appetite loss, and that of course generally means people will feel tired, unable to want to do things, and in an exercise environment can cause things like hypoglycemia with low blood sugar levels. So we need to be aware of how frequently people are eating, what they're eating, just to keep them safe in that respect. So you can see that that's a lot of side effects that people might be living with, and that's not even an exhaustive list. We know that nearly all the treatments that people are going to go through will have impacts on their health and fitness components. So, for example, cardiorespiratory function, muscular strength, endurance, their body composition, so their muscle to fat ratio, flexibility, motor neuron skills. We had tingling in the fingers, balance, coordination. Unfortunately, I mean, I told you I don't tell you great things, but it is going to have an impact on some of them to some degree, and therefore we need to have that at the front of our mind to be able to adapt. As I said, symptoms come during a treatment bout, but sometimes the side effects that people experience happen after the treatment and can be for up to years after the treatment. Some individuals might not have too bad symptoms during a treatment, but after the treatment has finished, the impact that that treatment's had in their body is what causes the problems long term. So we need to be very careful not to assume, oh, you've been through your treatment, you've recovered, you're now a cancer survivor, that's fantastic. We'll just treat you, we'll just train you as we would anyone else of the same age. You need to ask those questions and see whether there's any ongoing things that we'll need to adapt and be mindful of. And as I said before, just being very, very tailored to that person. Now, I'm sorry, because of my technological problems, you've had your break, and so I'm going to continue now. Like I say, put any questions if you have them over to the team and I'll answer them at the end. Let's look at the benefits of physical activity. Now, I would hope that you can sort of reel out loads of them. And again, this is not going to be exhaustive, but we're trying to be really specific. And I'm splitting these into physiological benefits as well as person-centered or client-centered benefits. And the reason for that is these are what I want you to know that you can achieve through exercise, sport, activity, and therefore be very motivated to try and help people to achieve them. However, the way that they're worded here isn't necessarily going to resonate with the person going through the treatment or that has survived cancer. So let's focus on what's actually happening at a physiological level. We can help cardiovascular health. We can reduce the risk of heart attacks and strokes. We can reduce blood pressure, all of the things related to the heart. And this is really important because chemotherapy can have an effect on your cardiovascular system. It can cause cardiovascular disease to occur. And so where possible, we want to combat that with regular activity. We've said that the treatments remove the ability of the immune system to do its job as well. Physical activity can boost your immune system when done in the right quantity and with the right frequency for that person. And so that's a huge benefit that we know that exercise can provide. We can boost metabolism. That will help with controlling and managing weight. It will also potentially help with their levels of fatigue that they're feeling. But mostly it's going to help by just ensuring that the body is working as optimally as it can to stop any other chronic health conditions developing, like type 2 diabetes. The inflammatory response that I talked about earlier, that the more inflammation we have going on in the body, the more detrimental over time it's going to be to our health. And activity, whether that's just going for a gentle stroll or doing a structured exercise session, can reduce inflammatory markers, and we really want to achieve that for these individuals. It will help anyone that's maybe experiencing lymphedema, anyone that has become inactive for a period of time, had surgery. It's quite a long list there. If we are active, we can help control inflammation. Certain treatments, particularly for those with digestive and bone-related cancers, see a decrease in bone mineral density, and exercise can of course then try and maintain, if not improve, that. And we want to achieve this so that we can help with mobility, we help reduce the risk of fractures and the risk of falls. So muscles, if you don't use it, you lose it. We all know that phrase, and unfortunately during treatment there's going to be a degree of rest and recovery needed for these individuals, and so as a result muscle wastage is likely to occur. We can't combat that solely, but we can help reduce the significant changes that happen by getting people just to use their muscles. Even just standing up from the chair, it stimulates the muscles. So we want to try and improve muscle mass longer term, maybe once the person has finished their treatment. But during treatment, it's about maintenance. It's about using the muscles, making sure that they remain functionally active on a daily basis, and stretching the muscles to prevent that stiffness that we talked about with radiotherapy. If people have treatment that's targeted towards the digestive system and the lower body, then they can find that their pelvic floor and their bladder control diminishes. And so incontinence and pelvic floor potential prolapses can happen sometimes with certain types of cancer and certain treatments. So thinking about how you can work on developing that core and pelvic floor health is really important for maintaining people's confidence in their ability to go out and about without having any continence related problems. And as well for back pain, you know, if we've got a stronger core and we're having to sit down to receive treatment for longer periods of time, then the stronger core will actually help reduce the likelihood of back pain. We know that mental health is going to be boosted with activity, and here we're talking about physiological reasons, and that's because we're going to boost the feel-good hormones, we're going to increase dopamine and reduce cortisol, which is our stress hormone, and just keep things balanced as much as we possibly can, and improve circulation. So these are all physiological things that can happen. You can see we've got all of the body systems really in there, and we know we can achieve this with everybody, but you need to look at your client and think, right, what do they need most, and what can we maybe look to try and achieve, and how will that impact them, and what kind of difference will that make on their lifestyle? So whilst you won't necessarily talk about all of those benefits to your clients specifically, these ones you might, and you wouldn't reel them all out, of course, you're going to pick the most specific ones, but we know that client-orientated benefits include channeling home that there is evidence and there is research that supports the risk of reoccurrence diminishing. Okay, so if people are active, they can either reduce the likelihood of developing cancer in the first place or reducing the risk of it reoccurring later after treatments. And that's obviously going to be a huge motivator and a reason for people to become active and stay active. And I know clients myself that have specifically come to me saying, I really hate exercise, but I've just been through cancer. They've told us that if we're active, then hopefully it will reduce its likelihood of coming back. And years down the line, it's still a case that they're attending, but that is their motivator. I know that that's their main motivator. We know that exercise can improve sleep. It can improve energy levels through sleep, through boosting the metabolism, which in turn will help control that maybe level of fatigue. It's not going to fix it. Okay, exercise is not a cure for fatigue related to these treatments, but it will definitely have a positive impact. It can improve cognition. You know, increasing circulation to the brain helps us focus, helps us have clarity. And you might have had people say, I've got brain fog, I just can't think straight, I seem to be in a bit more of a muddle since going through treatment. That's quite normal. It's a side effect of some of those, and through physical activity and being regularly active, they can improve that cognition. Improve flexibility, we said, improve confidence in their ability. It helps people feel a little bit more positive about their journey because they are doing something to help themselves, something that they can control, because so much of this cancer journey is outside of their control. They can't control their treatment plan, they can't control the cancer, but what they can control is what they do with their bodies physically and psychologically in terms of maybe mindfulness. All of these really help to aid confidence. So if we can encourage people to feel that way, then we're doing a really good job. Equally, reducing depression, anxiety, incontinence, like I said about before, managing or losing weight as needed, improving quality of life. We want people to have the best possible quality of life as they can as they go through this life-changing time of their life. And the only way that they can do that is by staying in control, trying to stay motivated and focused on what they have within their grasp to change. And I think having someone like yourselves in their lives is likely to really help, because you are directing them, you are giving them confidence in what they can and cannot do and should and shouldn't do too. But exercise and activity is so great for social engagement, social opportunities. Now, whether that's a class specifically for people going through the same thing or an event, some people like that. They like to meet people that are in the same shoes as them. Other people don't, and they want nothing to do with condition-specific sessions because they don't want to really be part of that condition. They just want to focus on themselves, and that's fine. that's something we need to know, and then you can promote accordingly. But whatever you do, it should be social, it should be engaging, it should be enjoyable and not a chore for them. And that way, not only do we engage them during the cancer treatment period, but hopefully following it and long term in the years to come after that. Now, there's a lot of research, and the research really looks at whether physical activity and exercise can prevent the development of cancer. And a lot of studies, particularly focused on breast cancer, colorectal cancer, have said, yeah, so there is a good statistical probability that if you are active for most of your life or active on a regular basis, meeting the guidelines, you could potentially delay, if not prevent, the development of cancer, which is great, really positive. Obviously, it's not going to be the case for everybody, and we hear devastating cases of people that have led the best lifestyles that you could and still developed it, and that's genetics, unfortunately. So the research is really positive for the prevention, but also for the management. And there's a lot to say about how you can help yourself, what's happening in your body, how you can really boost your immune system to support your recovery during the treatment process and then afterwards. So I do have access to some of these papers. You could look at them yourselves, but because of the length of this training today, we're just summarizing that there is a significant amount of research to support exercise and physical activity, remembering the difference. So physical activity is your walking, is your housework, is your gardening, and exercise is more specific, it's more intentional. It might be going to a class, doing a sport, going for a power walk. Both of these things can prevent and manage cancer, and particularly focused on colon and breast cancer, although the types of cancers are being extended in terms of what they're focusing on for research now. It's important to explain to clients that exercise and activity is safe. It's not going to make anything worse. It's not going to cause any further symptoms if it's done safely and suitably for their age, ability, and stage of the condition. They must listen to their own bodies. And because of that, we must listen to our clients and make sure that we take on board what it is that they're saying. So let me just touch on why physical activity can potentially prevent cancer developing. Again, hopefully, so you can maybe have these conversations and use it as motivation. So physical activity can lower estrogen levels as well as insulin levels. And these are two hormones that potentially put fuel on the fire, because they cause for the cells to multiply really quickly. So the greater the levels of estrogen and insulin traveling in the body, the higher the risk of cells being signaled to multiply quickly. So we don't want that. It can boost the immune system, making it more efficient. We've talked about that already. For digestive related cancers, activity helps to speed up the removal of harmful chemicals through the bowel. So when people are inactive, things travel through the digestive system and the bowel a lot slower than when they're moving. And so the more time that there is for things to stay within the digestive system, the higher the risk. So move it through, have a nice active lifestyle, eat well, and hopefully those harmful chemicals will pass through the system quicker. And I've already talked about, and just reinforcing here, the importance that you control inflammation as best you can. Inflammation does cause cells to rapidly multiply too, so just like estrogen and insulin up there. So if we can get inflammation under control, then we're decreasing our risk of developing it and it reoccurring later down the line as well. All right, we're doing very well here and we're on our home stretch. So we're going to just focus here on what we can do as exercise and fitness professionals to encourage people to exercise what's recommended, okay? So people should avoid physical inactivity, okay, during treatment and after treatment. It's a very old thought process for people to be resting only. Yes, we need rest during treatment, but the balance of rest and activity is super important, and inactivity is not recommended. The Physical Activity Guidelines Advisory Committee suggests that individuals should be encouraged to engage in recommended levels of physical activity to reduce developing cancer and for increasing cancer prognosis. So another statement just to reinforce the importance of what the messages are that we might be communicating. Now, the exercise objectives that you would achieve per client will be tailored to your client and what their needs are, what their desires are to get out of this experience. But what we can do is we can improve quality of life, reduce that fatigue, improve those energy levels, really just focus on keeping people functionally active so they can get ready themselves, go and get their own groceries where possible, stay socially active, maybe attending any groups that they're allowed to go to, and feeling good about themselves. That's what we want people to do. We just don't want this to impact their mental well-being any more than, of course, the diagnosis itself will have done. Now, I hope most of you on the call are familiar with the Healthy Population Guidelines that the Chief Medical Officer released in 2019 now. They're here on the screen, but just to highlight, people, whether it's people going through treatment or after treatment, should use these as guidelines to work towards, okay? Not a starting point necessarily for everyone, but work towards. There are guidelines developed by the American College of Sports Medicine for people that have had cancer and survived. They pretty much mimic these. So rather than putting it up twice, just thought I'd bring it all together and encourage our clients to do something rather than nothing. Okay, the message of anything is better than nothing should be what we mostly project. Even if that's a few minutes and they build up over time, then great. But ultimately, we want to try and get 150 minutes of moderate intensity exercise in per week. So that's getting your heart rate up, breathing a bit faster, feeling warmer, but still being able to hold a conversation. If people can exercise to a vigorous level of intensity, then around 75 minutes per week is what you want to aim for. And the research actually suggests that the harder you can go, the more intense exercise you can tolerate, the greater the outcome. So whether that is the prevention or the prevention initially or the prevention of it returning, and technically during treatment, but of course it has to be safe. So if people are feeling unwell and experiencing a lot of side effects, then you're not going to do vigorous exercise. But if they go through a point where they can, then encouraging people to maybe push that little bit harder can actually reap the rewards for them. It's going to be really important as well to ensure that you develop muscular strength, balance, and coordination in the whole demographic, regardless of their age, because we want to make sure that we keep them active in their independent life. So quality of life, functional fitness, super important, making sure that they can look after themselves. We take a lot for granted in terms of our flexibility when we have it. And balance, because especially with times of inactivity during treatment, it's very quick for us to lose our balance and our ability to dynamically walk. It sounds very extreme, but especially if we've lost muscle mass too, then balance needs to be integrated into the sessions to minimize the risks of falls. But the key message here is any movement is better than no movement, and try and listen to your body, listen to your client's body, and work out what's going to be right for them at that stage of the journey. And it might go up and it might go down, and it might go down some more, and then it might come back up, and that's fine as long as they don't lose sight of the reason that they're doing it and that they know that it will get them the benefits long term that they need. So these balance exercises need to be in. Pelvic floor and core exercises, where possible, need to be considered, especially for those maybe experiencing incontinence already. Flexibility and mobility, super important for all of the treatments, particularly surgery and radiotherapy, where we're going to see stiffer, sorer muscles and a reduced range of movement. And relaxation and breathing exercises you may not have in your current sessions, but maybe it's easy to actually integrate 5 or 10 minutes somewhere in that session you have with people to focus on this. And I think this is a really important area because people's breathing can actually be impacted through treatment. So teaching them to belly breathe, important. To control their breath for anxiety-related reasons, mental well-being, and to use relaxation and mindfulness so that they can shift their attention from, the negative and life-impacting things that they're going through to what it is that they can control, feeling more positive, and just getting people to really look after themselves. Think about how they can control their own well-being. So that social, emotional, physical, all of those components make up someone's health. And if they let themselves deteriorate too much during treatment, it's going to be so much harder for them to come out the other side and live a good quality of life. So we'll just finish here with some cautions and considerations to be aware of. Many I have identified as we've gone through, but hopefully this will just bring them to the front of your mind as we wrap up today. Because of the type of treatment, particularly for bone-related cancers, you might need to reduce the impact of the exercise, so not so much jumping and jogging. You may need to reduce the intensity and the volume of training and then look to increase it again, okay? So it's all about starting slow, see how the body reacts. People might get post-exertional malaise, so they might find that they're really tired after a session. And if that's the case, the session needs to be tweaked, because you don't want people feeling that they need multiple days to recover, because it's all about maintenance during the treatment and then progressing after that. Be aware of those side effects that we talked about, fatigue, sickness, and then adapt the amount of rest that you provide, both in between exercises and in between sessions. Those with low immunity might need to be careful of public exercise environments. So is there somewhere a little bit more private that you can control? That would be better for lots of different aspects of their session. But also as well with swimming, if I just jump down, because of radiotherapy and immunotherapies as well, swimming isn't necessarily recommended during that treatment. We've got peripheral neuropathy. We talked about tingling in the fingers and the feet. So we need to be aware of how we get people to do certain exercises. Is there a wall to hold on to? Is there something stable that they can use to help them? And whilst it might be challenging to do some of these things, we should still test the body. So using coordination, encouraging agility exercises to be built in is important. You know, you've got to use the brain, just like you've got to use your muscles to really help fire those signals and keep people active. If people have been treated for breast cancer or anything in their upper body, then upper body muscle wastage occurs quite quickly, especially compared to lower body. So be careful of the amount of resistance that you put through there and the intensity that you train the upper body at. It's more for functional maintenance and endurance initially, and then maybe building back up to strength. So think about the type of cancer and the stage of cancer, what the person has been recommended to do, maybe by a health professional. Think about the treatment that they're going through or that they've previously received. Thinking about what might happen later down the line. If they've had their treatment and they've recovered, great, but are there still things that are happening within the body or that they're experiencing that could have an impact on your session? Think about shorter forms of activity initially, because they might be better tolerated, and then try and build up to a longer length of session. And we talked about minimizing high impact exercises, be aware of that muscle wastage, and consider their fitness levels ahead of session. Some people might have been completely inactive before they actually trained with you or returned to your environment, came to your environment. And so they obviously can take it really steady to begin with, because they need to learn how their body responds to fitness in general. Others might have been super fit, and then you've probably got a little bit of a challenge to get them to focus mindfully on what is an appropriate amount of exercise for them to be doing as they return back, because people tend to want to jump back into where they used to be and then compare what they can and cannot do. So goal setting is going to be huge. Ensure you start all exercise programs slowly, build them up. And if you want to look into this more, then I recommend looking at the ACSM guidelines for exercise testing and prescription. And so very finally, I just want to touch on really getting to know your person. Who is it? What is their motivation to be there on that occasion with you? Consider what the benefits of exercise and activity are and which ones are most relevant to them. Consider what they've been through, what it is that they want to return back to. Maybe they had some hobbies or leisure interests that have maybe been put on hold for a bit and they want to return to them. You need to know these details about your client to really be able to communicate effectively with them. So find out what their motivators are, what their motivations for returning or starting to become active are. And then once you know them, really work on building a relationship. Because individuals living with cancer, having a cancer diagnosis, it's hugely life impacting. It can really develop it can really impact people's ability to know what's safe, what they should and shouldn't do. And as a result, some people just don't do anything. If you can develop a relationship which makes them feel confident in you, that they know that you're not going to make them do anything that would cause them any problems. If you're genuine, if you're empathetic, and you work with them, not dictate to them what to do, but you work with them to develop an action plan for their journey through treatment, after treatment, whatever stage they might arrive to you at, and you actively listen to them, they're going to feel a lot better about committing to this journey, rather than just coming to a session where there's no one there that really cares about them and their situation, because that person is not going to continue for the long term. And even though it might be a case of that they join a group initially, that relationship building is so important, to keeping that person motivated long term, when they might not need you as much later down the line, in a year or 2 years time, but they still know that you're there, you still understand what they're going through, and you've got that level of rapport with them. It's going to make a huge difference. So really communicate throughout the whole journey with the person, and try and get to their deepest reason of why they want to be there. So some might say to you, I want to reduce my pain or my fatigue. Great, that exercise can help with that, but why? Get to that level deeper, because it might mean that they can actually go walking with their friend again that they used to love doing, that they've stopped doing, that they can play with their grandchildren. There's normally a more fueling reason that people want to become active, rather than the benefits that we talked about physiologically, to that person. Even, I want to lose weight. Okay, but why? Will it give you confidence? Will it help you do a certain thing that you want to do? Try and really communicate the importance of the exercise routine in a way that's going to resonate with that person. Okay, so that's bringing me to the end. We've got a quick summary here. There's 200 types of cancer. I talked about some of the prevalent ones today: lung, breast, prostate, and bowel. 1 in 2 people will get cancer in their lifetime. We covered those 3 treatments: surgery, chemotherapy, and radiotherapy, the side effects of treatment and how they can impact the body, and then that impact that might have on the client. So be very careful of what those side effects are, the type of cancer, and how you're going to individualize that for people. Physical activity and exercise is being positively reinforced in the research as being helpful for preventing and managing the majority of cancer cases, with particular focus on colon and breast cancer. It is safe to participate in activity throughout the journey, and that's an important message to get across, but it is essential to adapt for that person. Ensure you thoroughly clean or screen clients to ensure that they have clearance to participate, that they are safe to participate, because we do not want to endanger them any further. And really reflect on your ability to communicate as a person, and make sure that you communicate empathetically. All right, here are some really great research resources and websites to go to, and these slides will be shared with you so you can have a little look at them. But otherwise, that brings me to the end of today's training. So thank you so much for listening. I hope that you found it beneficial, and I'm very sorry for the glitch in the middle. Thank you.
Emma, thanks as always so much for your time today. Really, really informative webinar that you've just given us, and appreciating that, the content that you squeezed down into sort of the hour and a half for us as well. So
yeah, I wanted to try and get it all across to you, but normally it is like 2.5 hours of training. So hopefully it came across okay at slightly faster pace, but thank you.
Yeah, no, really great, really great. We've got just a couple of questions for you. We may have answered one of them anyway, but questions come in around, do both chemo and radiotherapy make you feel very unwell?
Yeah, so as I said, sort of during that, it's very much dependent on the dose, the strength of that dose, and the time period at which it's being treated over, as to how people respond, and generally how people respond. Some people have better immune systems that coping with colds and just general things, but it's not like chemo is worse than radio or vice versa. For most people, it is about the strength of that treatment. And yes, people will feel very unwell if they feel weak, if they feel nauseous, if they're being sick all the time, what we'd feel like if we were just if we had a virus, you feel run down, don't you? And because that's generally prolonged over a longer period of time than a virus is, it does make people feel like they're unable to do maybe as much as what they could do. Then that impact on your mental well-being, when you are low in mood, if you are worried about things, that further exacerbates how you feel. So collectively, yeah, I think people do feel very unwell during treatment. But sometimes it's nice to hear people that are fighting through treatment very positively, and they're like, I actually feel quite good considering. But I think if you were probably looking and comparing individuals, they were going to be on a lower strength, lower dose medication, and maybe for a shorter period of time as well. But yeah, independent, really.
Great, thanks, Emma. And just a final question that's come in. How can people find out or find details of a trainer that potentially specialises in exercise for cancer patients? It's probably something we need to think about as an organisation, because we are doing a lot of work in terms of upskilling certainly exercise professionals to become level 4 qualified in cancer referral work. But yeah, I don't know, are there any websites or any information out there that people could have a look at?
So we used to have reps where you could literally search it and put cancer in, but I don't know if their website's already down now, because they don't really exist. So the next person I would say to go to is SimSpa, where you should be able to search a directory of people. This is fitness specific, although I think sports coaches can still register on SimSpa, can't they? But for cancer specialists, you can do that. Then there's a couple of organizations like Can Rehab. And what's the other one? I think, well, if you look at Later Life possibly, but Can Rehab, I believe, they train people up, and then they have sort of like a list of the instructors that they've trained per region, and I think it's their website. It's like find a Can Rehab instructor near you, so you could look at going down that portal. But this is definitely something that SimSpa is trying to nail, so that the public can search for an instructor that they need, and equally we can for colleagues to get in there. But I don't think it's perfect at the moment, but I think it's something to look at. And then, like you say, at your active partnerships, they might have an idea of who's trained, because of lots of active partnerships are doing workforce like research, aren't you, to work out who's got what, and etc. So yeah.
Okay, no, that's great. Well, we'll definitely take that one away and look at how we might be able to work with partners to disseminate the information out there in terms of those instructors that are working across the county, because there are instructors, because I know we've worked with them and we've given them details of training courses as well. So we'll take that away and we'll let people on the call know as to where that information is. I'm just double. There aren't any further questions, Emma, for you. So I guess it just leaves me to wrap up and say thank you so much to everyone for joining this morning's webinar around cancer and exercise. We really hope that you enjoyed the session. We've got one final poll for you just before you leave, and I'm just going to ask Mel to display that for me. And here we go, just a second poll then. So just based on this morning's webinar, how would you now rate your knowledge of cancer and exercise? 1 being no knowledge, and then 5 being very knowledgeable. So if you just complete that poll, that would be fabulous. Great, thanks, Mel. If you could just display the results. Oh, brilliant. Well, that's really, really, really pleased to see, because then when we first asked the question, people are sort of scoring around about a 2. So really, really great to see that knowledge and understanding has increased, and we're sort of looking at a good number of 4s there. So yeah, really, really pleased. So again, Emma, thanks so much for your time this morning.
Thank you for having me.
Thank you for everyone for joining this morning's webinar, and have a great rest of your day.